Hi, good morning. Thank you for joining us. This feels a lot like a conference because we keep bouncing from conversation to conversation, and I've been trying to get up in between and run around my kitchen. So I feel like I ran through the hallway and came back. I'm just trying to get the slides pulled up. Let's see. This is the American Indian Alaska Native Opioid Response Work Group breakout session. My name is Vicki Lowe. I'm the Executive Director. Oh, sorry, I think I'm supposed to turn on my camera. I'm the Executive Director for the American Indian Health Commission. And, and I have with me here Lisa Ray Thomas, and Lucy, who works with the Commission and also works with the University of Washington, and Lucy Mendoza from the Healthcare Authority. And we've been working on this project for a while. Lucy, do you want to, can you guys turn on your cameras and introduce yourselves?
Yeah, I will. Is Lisa here?
Yes, I think she is for now. And
Lisa, you want to go first? Sorry.
I am here. I don't know how to turn on my camera. I'll figure that out. Hi, everybody. Thank you so much. My name is Lisa Ray Thomas. I'm a member of the Tlingit tribes, and as Vicki said, I've been working with the Commission on this opioid response work, and I'm also with the University of Washington Alcohol and Drug Abuse Institute. And I want to apologize to everybody. I'm managing a family medical emergency, so I might need to step in and out. And I just really want to express my gratitude, first of all, to the Opioid Response Work Group members who have done such an amazing job. And then to Vicki and Lucy, who at the very last minute are stepping in to lead this. I really appreciate it. Thank you.
Thank you.
Alrighty, and I will show my camera in just a minute. I won't say why, but good morning, everyone. It's really good to start this group today. I was looking at the schedule. I don't know, it was kind of hard to choose the breakout sessions because they're all so good. So I appreciate you being here, and I appreciate us having this conversation. We've been working kind of on this, not kind of, but we've been working for a couple years, I think a couple years now, on really forming this statewide focus on opioid use disorders, specifically for American Indians and Alaska Natives. And it's definitely something that we want to keep focus on. And I know we have great leadership on this with Lisa and Vicki. So I am excited for our session today.
Thank you. And we have a smaller group, which we decided when we have smaller groups will allow people to introduce themselves. Man, I'm big on that screen. It's like having a mirror in front of you all day long when you have to have your camera on. So if Tara, is everybody unmuted? Can I just like call out names and people can introduce themselves?
Yes, I unmuted everyone, so they can just turn on their microphone if they want to introduce themselves.
Okay, so we'll go alphabetical and we can start with Candy, who I just met in the last room. Candy, do you want to introduce yourself? Can you unmute? I don't know if it's not working. Cindy, are you able to unmute yourself and talk?
Let's see. Can you hear me?
Yes. Yes.
Oh, wonderful. Okay, so I guess I can. Good morning, everyone. My name's Cindy Gamble. I am Tlingit, and I am a tribal community health consultant with the American Indian Health Commission, and just having fun and learning lots at this at our summit. So thank you.
Thank you, Cindy. Candy, are you able to unmute now? Maybe she took a quick break.
Here she is.
Can you hear me now?
Yes, yes.
Oh, good.
We
This
can,
is Candy
yeah.
Rogers. I'm with Healthcare Authority.
Thank you.
My video isn't
Like I
working
said,
though.
we just met Candy in the last in the networking room. And Janice Peoples.
Janice Peoples, pharmacy auditor for Healthcare Authority and program integrity. I'm also working with our group concerning our PMP, the opioid narcotic review team. I've done that off and on over the years, so here I am. Let's see if we can get some really good information today.
Yeah, thank you for joining us.
Thank you.
Jasmine Albinson. Did I say that right?
Hi, you did. Jasmine Albinson. I'm an account executive at DH, and I support the Healthcare Authority's Washington Tribal Opioid Solutions campaign.
And you're going to be presenting as part of our agenda.
Yes.
And Jason McGill, who kind of helped start some of this work. Jason, do you want to introduce yourself? Wait, you only brought one person. Hi, Lucy. Jason, are you able to unmute yourself and introduce?
Jason's unmuted, but I think he might be away from the computer.
Okay. Okay. So next we have Marilyn Scott. Marilyn, are you able to introduce yourself? Oh, we can almost hear you.
Good morning, everyone. This is Marilyn Scott,
Good morning.
and I'm the vice chair of the Upper Skagit Tribe, and I've participated with the opioid work group for initially since the Region 10 started the opioid strategic planning, and then we started the statewide, and then we implemented the tribal opioid work group. Thank you.
Thank you. Phyllis Coolin.
Good morning. This is Phyllis Dolan, and I'm a nurse consultant with Healthcare Authority in the Program Integrity Section Division. Glad to be here.
Thank you for joining us. And Jason, are you able to introduce yourself? Okay, we also have Carola Bernays. Are you able to introduce yourself?
Hi, can you hear me?
Yes, we can.
Hi, this is Carola Brenes. I'm a Tribal Prevention System Manager with DBHR at HCA.
Thank you. Thanks for joining us. Francesca Hernan.
Hi, good morning, everyone. This is Francesca from Seattle Indian Health
Are you able
Board.
to unmute and introduce yourself?
Oh, can you hear me okay?
Good morning. Thanks for joining us. Yeah, yeah.
Oh, great. Sorry. Thanks, everyone.
And then back to Jason McGill. Okay. Well, when Jason worked at the governor's office, he helped look at some kind of opioid response. Oh, are you trying to talk, Lucy? No. And so I was happy to see him on here. He's since moved to the Healthcare Authority. I can't hear you, Lucy. Oh, because you're muted? It says you're self-muted. There you go. Oh. I still can't hear you. I'm cutting in and out. Can you guys not hear me okay?
I was going to say the same thing. There's a weird lag in your video and audio. And I also can't hear Lucy.
Okay, I'm going to turn my video off. I still can't hear Lucy either. There's Lisa found her camera. Okay, can you hear me better?
Yes. I've said it before. This is Lisa, and I'm going to say it again. The most said words of 2020. Can you hear me? Can you hear me now?
It's true. So we'll get started as long as my audio is still okay. Oops. For those of you who aren't familiar with the American Indian Health Commission, we're a tribally operated nonprofit that was formed by tribal leaders in Washington State in 1994. Our mission is to improve the health status of American Indians, Alaska Natives in Washington State through cooperation with between the states, the urban programs, and the tribal governments, and working on health policies and programs to help decrease health disparities. We have, 29 tribes and 2 urban Indian health programs, plus the American Indian Community Center, who we work for. And our delegates are appointed through either a tribal council resolution, or for the urban programs, they are appointed through their board. So they speak on behalf of their tribe or urban program. I think it's important to do land acknowledgement, and this is Native American Heritage Month, but we should do this all year. Normally we're in the same room, so we're on the same land. So I'm going to say this land acknowledgement, and maybe think about if you know whose land you're on, and just give thanks to them as well. I would like to begin by acknowledging that as we gather today, we are all on the ancestral homelands of the indigenous people who have lived on these lands from time immemorial. Please join me in expressing our deepest respect and gratitude for our indigenous neighbors. Where I live, that is the S'Klalams and other Salish people. We thank them for their enduring care and protection of our shared lands and waterways. And Nusklayam is how we say it in S'Klallam, means S'Klallam, and the S'Klalams are the strong people. So we're already behind. We did welcome, land acknowledgement, and introductions. We're going to talk about the work so far. We've been doing this, did we decide, for a couple of years, 2 years? And there's been other work that kind of preceded that. We're going to talk about the responses to the opioid response survey, and then we'll share some of the Northwest Portland Area Indian Health Board opioid response strategies. We'll hear from Jasmine about the Tribal Opioid Solutions Campaign, and then talk about some next steps. Lisa, do you want me to keep going, or do you want to?
Yeah, I just wanted to.
How are you feeling?
I just put this in here, even though it's out of date already. These were the original deliverables for the work that the American Indian Alaska Native Opioid Research Work Group was doing, and the original grant was only for a number of months and did not allow for us to do the work using an Indigenous methodology and making sure that we were inclusive. So Lucy was really great in renegotiating the contract so that we actually could do the work in a more intentional, meaningful way. And then in January, I fell and fractured my wrist and had surgery, so couldn't use a computer effectively for 6 weeks, and then the pandemic hit. So it really impacted our ability to do everything that we wanted to do. And I just wanted to acknowledge that because the tribal leaders clearly had to turn their attention to protecting their communities and keeping them safe. So we're excited to be with you today to keep moving this work forward. That's all I have to say about that slide. Thank you.
Thank you. Yeah, it's amazing to look back at it, think of what we were trying to do. And as all of our work has been impacted by COVID, we've tried to really, the commission staff meets every Tuesday at lunchtime to really talk about what we're doing and you know, how we're adapting our work to deal with the COVID response. So this is a graphic of the Pulling Together for Wellness framework, which is a framework that was co-designed by Tribal Leadership Advisory Council, and it guides the work of the commission, and we are working to help some of the tribes across the state adapt this as a framework that they can use. And it's more based in decision making, but it's really grounded in our Indigenous values, has a lot of components. Jan did a explanation of it yesterday, but just a reminder that when we do our work I think in the past, there's been frustrations with funding sources because they come at us with, you know, you have to use that phrase I hate, evidence-based practice. And what we know is the practices of our tribal and urban communities are older than those evidence-based practices. And so they're practice-based evidence, and we know they work on our people. So we need to be able to incorporate, you know, our values and our way of doing things into the work that we're doing in order for it to actually be effective. And a big part of that is the down below underneath in the longhouse down there in generational clarity is historical trauma, ongoing discrimination, racism, equity in the social determinants of health, dealing with adverse childhood experience and lateral violence and oppression. I think especially in this opioid response work, it is important to remind ourselves that is part of the work to deal with that. Let's see. So Lisa and I talked when we first were talking about the funding and the work plan about how important it is to do and to have an Indigenous methodology. So I really appreciated working with Lisa on this. And those principles are here on the screen: sovereignty, grounded in culture and community, focused on inclusion of cradle board and elders, that 7-generation thinking, you know, thinking that what you do impacts 7 generations, and we're all at different stages in those 7 generations. Strength-based work, being collaborative, being iterative, and using Indigenous science, so not just relying on Western medicine, but also the teachings of our elders. Do you want me to keep going, Lisa? Or?
Thank you. I can be present for a little bit here. So, okay. One of the well, after the work group decided on the Indigenous methodology, the next step was to develop a survey to better understand the needs and resources around for American Indian Alaska Native tribes and organizations, urban programs regarding the opioid public health crisis. So we developed a survey, had 28 questions, and even though we listed who responded, which tribes and organizations responded, we did not attach the data to the individual respondents, so all the data is anonymous. We distribute it widely through the work group, through tribal leaders, through the Health Commission newsletters from October 2019 through January 2020. We got 24 responses, which was great, from 18 different and unique tribes and American Indian Alaska Native organizations. The respondents were mostly health directors, but we did have a variety of people responding, different providers or care navigators. And we also included some open-ended questions. So one of the questions we asked was, how concerned are you about the opioid public health crisis? And all but one expressed that they were, everybody expressed concern, and all but one were extreme to very concerned about it. And the one person was moderately concerned. The primary concerns were fatal and non-fatal opioid-related overdoses, the impact on children and youth, and the risk of youth and the risk for youth to develop opioid use disorder. We also asked what is already working or could work in communities to effectively address this issue. And these were the top responses. We're going to provide the entire summary because there are actually a lot of solutions that people offered, but these were the ones that were mentioned most often. So first was medication-assisted treatment, or what's now really being called medications for opioid use disorder, offering wraparound services and whole person care, the availability of naloxone to prevent fatal overdoses, addressing trauma, improving access to treatment, and culturally based services. So these are the things that people that participated in the survey said were working and or could work in their community. We also asked what kind of services were available in different tribes and organizations. Again, there's a really long list of unique responses, but these were the ones most mentioned. So behavioral and outpatient treatment services, access to medications for opioid use disorder with naltrexone, which is also known as Vivitrol, access to medications for opioid use disorder with buprenorphine, which is also known as Suboxone. And people said that providing access to these medications really, what they were most excited about, or what was most important to them, was that it was improving the lives of the individuals with opioid use disorder and was allowing for family reunification. And then the last service that was mentioned most often is culturally based treatment. We asked about what were barriers that people with opioid use disorder were experiencing in accessing treatment. And stigma was mentioned by almost all respondents. And we asked how much of a barrier were these things. And stigma was rated high to extreme in terms of being a barrier. So that's super important as we're thinking about how to better serve people with opioid use disorder. So addressing stigma. And this is not unique to American Indian Alaska Native communities. The work I do at the University of Washington, where we work with this issue statewide, stigma is also probably the biggest barrier. Another barrier was readiness. So having people be ready to access treatment. Actually having access to best practices for treatment was a barrier, and then childcare. So these were the 4 things that were mentioned most often. And again, there's a longer list in the full report. When we asked how communities could better support their community members in accessing treatment, so access again came up. So working to make sure that everybody that wants treatment has access to treatment. Compassion, so feeling compassion and expressing compassion for people struggling with opioid use disorder and their families. Culture, providing culturally grounded, not just treatment services, but really cultural activities and participating in culture. And then having culturally attuned providers. I'm trying to remember what is this about. So we asked people how community members in their community access accurate information about opioid use disorder and treatment. So these were the things that were mentioned most often. So their tribal clinics, community meetings and gatherings, and then from friends and family. And this is important as you're thinking about responses in your own communities as avenues to make sure that people are hearing the most accurate information and up-to-date information. And I'm sorry, I probably should have invited Marilyn Scott to make any comments at any time. I can't see if Marilyn raises her hand or wants to speak, but Marilyn participated and other people on this call participated in all of this. So please interrupt me if anybody else wants to talk.
Thank you.
Lisa, the only thing I wanted to add to the discussion, and I really feel it's so important to recognize the background that you have, although you're working with the Alcohol Institute with the University of Washington, the work that you did with the Suquamish tribe and the Port Gamble tribe with the development of the curriculum of the, because the cultural experience with the tribe, it makes a big difference in understanding how to deal with, and we're going through this now with the COVID-19, our tribal community members dealing with their stress and the crisis that the families are going through with losses in their families. They're needing to utilize their traditional ways and cultural practices to support the activities that they're having to do in prevention of relapse and all kinds of things. So I just wanted to make the comment that the work that you did with the Suquamish and the Port Gamble and the development of the curriculum with the prevention work and the youth, it all ties together with the importance of our cultural ways with the opioid work, that strategic planning that we're doing. Thank you.
Thank you, Marilyn.
Thank you, Marilyn. I would just add too that, when this funding opportunity came up and it turned out that Lisa could do the work, I just felt like it was meant to be. And so it's just been great having you lead this work, Lisa.
Thank you. So then, and we can go ahead and go to the next slide, please, Vicki. So when we, this is so weird to say, because when we did the first survey, we had zero idea that COVID was coming. And although the results that we got from the first survey are really important and can really inform moving forward, COVID has turned everything upside down. And so we did a follow-up survey to assess the impact of COVID on opioid use disorder. There were 9 open-ended questions, and we distributed the survey similarly as the first one, and we received 11 responses to the survey, which I was really appreciative of, because I know this was early in the pandemic and everybody was scrambling to make sure that their communities were as safe as possible.
Oops. There we go.
So these are the questions that we asked. Can you please share how COVID-19 has impacted people with opioid use disorder in your community? How has access to treatment services for OUD been impacted? Better access, worse access, or other? How has engagement and retention in treatment services for OUD been impacted? What are your biggest concerns about OUD and COVID-19? Are opioid-related overdoses increasing in your community? How are you responding? What do you need? How have you innovated for services for OUD because of COVID-19, and what innovations would you like to continue? So these were the concerns that were expressed most often. Increase in fatal and non-fatal overdoses, potential increases in people experiencing depression and anxiety, the impact of prolonged isolation on community members, concerns about potential increases in suicides, concerns about people being able to access telehealth services, especially at the beginning when that was all that could happen, concerns about employment and the impact of that on community members, and the inability to hold ceremonies, cultural ceremonies together. And then this was all open-ended, so there were a number of quotes, but I just pulled out a couple. So social isolation and general unknowing of what the world will look like next week, never mind next year, are contributing to higher overdose and relapse rates. So these were what people reported being most concerned about. So the impact of COVID-19 on access to OUD services, lack of access to services was the most reported impact. Lack of personal protective equipment, both for providers and for people accessing services. And this was earlier this year. I understand that the tribes and urban Indian organizations have been working really hard and have been responding and accessing PPE for their providers and community members, and innovating to increase access to services. So while these were reported, gosh, what is it, like 4 months ago? I know you all have responded and are addressing this. And then both providers and community members not being comfortable with telehealth. And here's a quote: engagement and retention with telehealth was difficult. Many clients did not like the telehealth services and declined to participate, or were unable to participate due to a lack of appropriate equipment or poor internet connection. And again, I know all of you, and including with support from the Commission, have been working really hard over the last few months to address this, and it's greatly improved since the survey happened. When we asked what people needed, the thing that was referred to most often was staff, needing more staff training, and staff support. Also, housing support for community members, overdose education for community members, and figuring out how to do community outreach in the time of COVID. So these were the things that people expressed most often as being needs. And the quote, support for staff members. This has been really difficult on them as well, especially in situations where they have been working on the front line this entire time. When we asked about innovations that providers and communities have been able to implement, these were the things mentioned most often. So providing services via telehealth and hybrid services, hybrid being a combination of virtual and in-person services, providing phones and laptops to people seeking services, developing Facebook campaigns, increased length of medication prescriptions, and this is mostly for people who are receiving buprenorphine or Suboxone. So the regulations have been relaxed. Relaxed is the correct word, modified to decrease the risk of exposure and increase people's ability to continue with their medication. So patients who might have been getting a 1-week prescription, if it was safe for them, could get a 2-week prescription, say. So that's what that is. And offering more peer recovery support and offering drop-in online groups. So these are things that people reported as innovations. And the quote is, offering more individual services to keep people engaged and work around schedules with school, childcare, etc. Whoops. Trying to be as flexible as possible to meet the needs of clients. Because of course, in the middle of all this, most, if not all, children are being remotely educated. And so it's another thing that families and parents, caregivers are having to work around. So one of the things that the work group has looked at is a book, I guess you could call it, that the Northwest Portland Area Indian Health Board put together. It's I don't think I have the title correct, but it's a National Opioid Response Strategies document where the board has worked with tribes and American Indian, Alaska Native urban organizations around the country with individual interviews and focus groups, and then organized all the information they gathered into potential strategies that we can and communities can map their needs and resources onto the strategies, so not starting from scratch. And I sent that to you, Vicki and Tara. I don't know if you want to pull it up or if we just want to distribute it to people. Or maybe I sent it as a PDF, I think.
I think we can put it as a handout, Sarah.
Okay.
Yeah, which one was it? I'm sorry.
It's the Northwest Portland
I tap
Area
out
Indian
on
Health
tech
Board.
skills when it comes to that. We'll stick it in there.
Well, you're ahead of me. I couldn't be doing what you're doing and talk at the same time.
My audio keeps cutting out, so I couldn't really hear you, Vicki. And so, Lisa, could you please repeat which document it was?
Yes, it's the Northwest Portland Area Indian Health Board Opioid Response Strategies document.
Okay.
I titled it different than the title of the document is. But it does have Northwest Portland Area Indian Health Board in the title of the actual document.
Okay, I found it, and I'm adding it to the handout section within this GoToWebinar. It's kind of large, so it's going to take a few minutes to upload.
Okay. Yeah, and we can send out it's a PDF and it's also a link, so we can make sure that we send that out as well. Or while when we have the presentation on the Tribal Opioid Solution Campaign, I can send the link to you, Tara, to put in the box.
Okay, thank you.
Mm-hmm. I think we can go to the next slide. Yeah, great, thank you. So Lucy, I'm going to turn it over to you and the Tribal Opioid Solutions Campaign folks?
Sure.
Tara, are you able to make Jasmine a presenter? That's what we want to do, right?
Yes. Can you hear me?
Yeah, we can hear you.
That's great.
Now.
Thank you so much for the summary of the surveys and the challenges and barriers and strengths and innovations that you shared. I always loved listening to how well you're able to kind of summarize, bring everything together, Lisa. I think it's amazing. So I appreciate all that work and also helping this group to keep grounded in really the concerns around COVID and making sure that we take some time to address that and the impacts of OUD during this really challenging time since we're not out of it. We're excited to have Michelle Hagee and Jasmine Albinson to present on the work of the Tribal Opioid Solutions Campaign. Our team has been partnering with DH for a few years now to work on the Tribal Opioid Solutions Campaign, and we're actually in year 4. We're getting ready to launch year 4 and starting to implement that. So it's great to hear some of the successes from what we've done so far, and then also what we would like to accomplish for the next year. And I'm really glad that they were able to participate in the whole meeting. And I'll let them talk more about that, but I think it's important for us to be able to try our best to align what's happening with this work group with any of the strategies that we'll be implementing at Healthcare Authority around opioid use disorder, in working on strategies or implementation for American Indians and Alaska Natives in the state of Washington. And so, so I'm really glad that they were here to listen to those survey results and then also present. So I appreciate your time, Michelle and Jasmine. I will hand it over to you for your presentation.
Thank you, Lucy. This is Michelle Hagee. I'm the CEO of DH and Jasmine's colleague, and we're very honored to be with you today to share, as Lucy said, some results from last year and a preview of our plans for the coming year, and we're eager for your feedback and thoughts. I would like to start out today just telling you a little bit about our company, Desatel Hagee. We were established about 24 years ago by Jim Desatel, who's a Colville member and is now retired, but I was Jim's first employee all those many years ago. And we're very proud to have a Spokane-based agency that does work all around the Northwest and beyond. We do advertising, public relations, branding, research. We have a team of 29 folks, and we have a long history working with Northwest tribes. And in the public health space, our company has a very robust social change marketing practice where we're really working with collaborators like HCA who are focused on changing behaviors for the health and well-being of our people. And so we've been able to, very honored to have worked on the Starts With One opioid misuse prevention campaign with HCA and on the Tribal Opioid Solutions campaign, which is really a sister campaign to the Starts With One work statewide. We also work on issues ranging from immunizations to West Nile virus prevention, traffic safety, and a whole host of other public health issues. So that's a little bit about us, and I'm gonna have Jasmine jump in to give you an overview of this year 3 of the campaign that we just completed.
Thanks, Michelle. So phase 3 of the Washington Tribal Opioid Solutions Campaign was a statewide media campaign aimed at reaching tribal communities. We had 4 major goals, which were to raise awareness amongst tribes about the dangers of opioid misuse, raise awareness of safe storage, safe use, and safe disposal practices in tribal communities, raise awareness of how to prevent and respond to an opioid overdose, and raise awareness of MOUD and treatment options with special attention to women who are pregnant or parenting. Over the past few years, the campaign has developed tools designed to assist tribes and tribal organizations in their own prevention and treatment work in their communities. With a lot of dialogue and input from tribal representatives, we've developed messaging around topics including safe storage and disposal, overdose response, pregnant and parenting women, and medications for opioid use disorder. The goal was really to provide materials that complement the wide range of work tribes and tribal organizations are already implementing in their communities. Tribal engagement and input have been really crucial as we've developed campaign priorities, strategies, and tactics. So to kick off the campaign, we developed the Dear Tribal Leader letter that HCA Tribal Affairs sent to their network of leadership. The letter introduced phase 3 of the campaign, the new tools available, as well as how tribes and tribal organizations could apply to receive technical support. We presented at 2 monthly tribal meetings in January and May to provide campaign updates, share our proposed plan, and solicit feedback. We also presented to this group back in May to provide an update on the success of the campaign after its completion. And a big thing we did last year was create an informal review group of tribal and urban Indian community representatives to offer feedback on the campaign plan and materials. In an effort to reach tribal audiences across the state with campaign messaging, we implemented a 3-pronged paid media approach. So our first strategy was geofencing tribal communities. And with this approach, once a smartphone or digital device entered the defined geofenced area, we were able to serve display and video advertising to that device as the user browsed the internet. So it allowed us to deliver ads on news sites like CNN, Yahoo, and Forbes, as well as any other site that accepts display advertising. The smartphone user was able to see ads for several weeks afterwards, even if they left the targeted area. And our original strategy, I just want to note, was to geofence tribal events in community buildings, but due to COVID-19, we pivoted our strategy to reach broader audiences on tribal reservations. Our second strategy was statewide digital targeting. We ran video pre-roll and OTT ads, as well as Facebook video ads to reach this audience. And for those who may not be familiar with those terms, pre-roll includes a video ad that appears before a user tries to watch a video on the internet. And then OTT includes a video ad appearing on a streaming platform such as Hulu or Roku before someone watches their show. Our third strategy was tribe-owned media, which included media buying in locations and outlets that are owned by tribes and tribal organizations across the state. So the pictured charts are major performance indicators showing the scope of campaign impressions, reach, and clicks from the media buy. So our campaign tactics, including gas stations, print, and digital advertising, achieved over 5 million impressions and drove over 12,000 clicks, showing that we successfully delivered advertising to tribal audiences. We also saw success driving users to the updated microsite. When looking at our website traffic over the course of the campaign, we noticed a significant increase in total users, new users, sessions, and page views. A large part of our year 3 strategy was also to revamp the campaign microsite to make it easier to navigate and the resources more accessible. And the development of the website included several activities to customize the site for tribal communities. To understand how the campaign microsite could be enhanced to best serve tribal audiences, we conducted initial user research through a card sort exercise. So in collaboration with our informal review group, we recruited 50 participants to explore potential organizational structures of the website that would enhance user experience and organize information in a way that feels natural. Following this research, we presented a sitemap detailing an enhanced content architecture and navigation structure for the site. So the sitemap took into account the current content, tools and resources available, and the possibility to add new pages and topics in the future. We also completely overhauled the campaign's online toolkits. We merged toolkit resources for prevention and treatment, and using the resource page template on Get the Facts RX as a baseline, we built an additional organizational feature to sort materials by either message or by type. So you could search for materials based on treatment or safe storage, or you could search for any materials that are rack cards or digital ads, or whatever type you're looking for. This is our new homepage, which, as you can see, allows you to easily navigate at the top by topic. And then at the end there is the partner toolkit with all of the tools we've created that are available for download. And then if you scroll down on the homepage, again, you can easily navigate to a different part of the website based on the topic of information you're looking for. For technical assistance, we worked with 6 tribes and tribal organizations across the state to support localized implementation of the campaign that address the specific needs and experiences of their communities. So to paint a picture of what technical assistance support can look like, we're going to give you a snapshot of the support we've provided a few individual tribes and tribal organizations in particular. During our first kickoff call with the Lower Elwha Health Department, they communicated that their overarching goals included strengthening their engagement on social media, informing community members through tribal-focused education materials and prevention activities, as well as increasing awareness of local health services and resources that are available to the community. So to help them meet these goals, we developed a social media strategy guide that included best practices around social media engagement. We created monthly content calendars that spotlighted community events and initiatives, as well as campaign topics relevant to that community. And then we also boosted their Facebook posts and developed a campaign intended to increase their following that their team plans to implement in the future. The Yakima Nation Tinuit program expressed a need to raise awareness around overdose prevention and treatment resources in their community, to better connect with residents, and to engage with youth. To effectively address these needs, we developed customized lawn signs, magnets, and stickers with a unified campaign look and feel to be distributed to community members and to really foster ad recall around this message. We also restocked their inventory of rack cards in addition to implementing a Snapchat campaign to advertise to younger audiences on the reservation. We also ran a billboard during the summer months on one of the most high traffic freeways in the area. And then pictured here are additional examples of support we provided tribes and tribal organizations throughout the campaign. When the campaign came to a close, we conducted 15 phone interviews with tribal leaders across the state to gain an understanding of how they experienced the campaign areas that need improvement, as well as priority messages for next year's campaign. Interviewees indicated an overall positive campaign impression, specifically calling out representative images and culturally appropriate messaging on all materials. They expressed concern around outreach among COVID-19 and how to continue to keep opioids top of mind. We also heard a need for expanded prevention and treatment messaging, as this was frequently mentioned during our evaluation interviews. And the majority of the interviewees expressed the need for more digital assets, especially as in-person events aren't taking place at this time, as well as ways to engage and connect with younger audiences. Interviewees also expressed that the new microsite is comprehensive and easy to navigate. We received feedback that the media buy created a good statewide reach among tribal audiences. We also heard that technical assistance participants appreciated our partnership, but often felt that it was challenging to balance competing priorities, especially during COVID. And many interviewees expressed that more custom photography and video would be great additions to the campaign to authentically reflect tribal members doing everyday activities. So with that, I will hand it back to you, Michelle, to take us into year 4.
Thanks, Jasmine. And I'm just going to pause here for a moment to see if anyone has questions about last year's campaign.
Hi, Michelle. This is Tara. I'm moderating the group today, and I just wanted to ask everyone quickly, has everyone been able to hear the audio during this presentation? Mine has cut out a few times, so I just want to make sure everyone else has been able to hear.
This is Lisa, and yes.
This is Cindy. Yes, I can hear.
Okay, good. Thank you, guys.
Thanks for checking on that. I'll jump in. We just have a few slides to give you a preview of this coming year. And as you have questions, make a note of them, and we'll pause again for feedback that you might have for us. So we've spent some time talking about the feedback that we got last year, which has really informed the priorities for year 4. As Jasmine talked about, the feedback from our informal advisory group for the campaign has been instrumental in helping us to develop strategies and campaign creative. And so they will play a key role in partnering to design year 4 materials. We also are acting on the recommendations about additional creative assets, and we'll be doing some new customized video and photography in order to expand those resources and have more assets that really do a good job of showing our Northwest tribal landscapes and our people here in the Northwest as well. And then we will also be emphasizing digital paid media tactics. As Jasmine talked about, what we're seeing during COVID, of course, is that we're all spending more time on our screens, and that we don't have the in-person events that we typically have. So our digital advertising will continue to be important in 2021. And then we also in year 4 will be developing some new prevention and treatment messaging to, again, expand our tools and be able to address some new issues that are relevant to the opioid issues. We'll be starting our year 4 campaign with again, working with our informal advisory group. We'll be sending a Dear Tribal Leader letter to all of our tribes in Washington State, and we'd love to continue to interface with this group and also with monthly tribal meetings that HCA hosts in order to share our campaign activities and receive ongoing feedback. And I mentioned already continuing with this informal group. The folks have been so helpful in giving us advice as we go. And if anyone on this call has interest in joining that group, Jasmine's email is here on the screen. And of course, Lucy can also reach us anytime, but we would love your participation. We are also going to continue with technical assistance, which you heard Jasmine talk about. We're wanting to try to make it easier this year. We're going to actually remove the application process and just stand ready to help tribes as they come forward with requests for assistance. And our team can do everything from helping a tribe or a tribal organization to customize their own campaign materials, to develop social media content and strategies for reaching their audiences on Instagram and Facebook and Snapchat. We can help with media outreach, with news media. We can help with event support, virtual event support, and just ongoing communications consulting. So those are all things that our team can help tribe and tribal organizations with. As we've talked about developing some new creative, we'll be working with local videographers and photographers to develop some new videos and also capture additional custom still photography. We've gotten recommendations to get more landscape photography and just ensure that we have a good diversity in that photo library so that we can provide, the right feel photos for tribes, whether they're on the peninsula or the plains, and have a good fit for folks. Our paid media strategy, this is our advertising strategy. We're going to continue what's been a very successful kind of three-pronged effort that you heard Jasmine talk about. Our statewide digital targeting ads allows us to reach people in our state who have self-identified as American Indian or Alaska Native, and we can reach them wherever they are, whether they're in Seattle area, they're in the Yakima area, wherever they are in the state, we can reach them and deliver video ads, as Jasmine talked about, on their smartphones, in their Facebook feeds, on websites, and on streaming platforms like Hulu, where they might be watching television shows. We also can geographically reach folks with what you heard Jasmine talk about, which is called geofencing or geotargeting, where we basically can reach folks in a zip code and again deliver ads on their smartphones, video ads and static ads. And we have found that Instagram and Snapchat have both been powerful platforms in order to reach our younger demographics with prevention messages. And then the third piece of that strategy will continue is with our tribe-owned media all over the state, has been a really important cornerstone of the advertising strategy. And then lastly, every year at the conclusion of the campaign, we repeat these phone interviews with tribal leaders and leaders in tribal organizations who can give us feedback on how they experienced the campaign, what they'd like to see in the future, and that helps us every year shape the next evolution of this campaign. So what's next? We are going to, with Lucy's help and her office, will distribute the Dear Tribal Leader letter, which will kick off year 4, and then we'll open up the requests for technical assistance. And again, here's our information, Jasmine's email. If you know someone, if you have an organization that you'd like to connect us with, we would love to hear from you. And we'll be meeting with our informal review group. And again, anybody on this call who has recommendations for folks, or if you'd like to serve on that group, we would really welcome that. And I'm going to pause here again to ask for thoughts, reflections from the group, questions, anything that's on your mind about this campaign. Okay, well, if there's no questions from the group, we want to thank everyone for letting us present today, and we hope to see you all again.
Yes, thank you.
Thank you. It's great.
Thank you.
Not quite sure how to stop.
Yeah, I may be formulating some questions in my head, but I wasn't able to get them all the way out. So I'm going to email Jasmine.
Great.
Hi, everybody. This is Lisa. Thank you so much for that presentation and for all the work that you've been doing. We can see that what you're developing is also aligned with some of the needs and gaps that were identified in the first and second surveys. So that is really amazing. Thank you.
Lisa, are the slides that were shared available, or can they be emailed out?
Yes, I actually am going to ask Tara or Vicki to answer that. I mean, they have them, and I'm going to say that I saw a typo coming up, so excuse that. But in the actual slides, in the notes section, I copied and pasted the longer list of responses, so you'll have access to that too.
And Marilyn, just so you know, we're recording all of these, and we will be posting the presentation on our website along with the PowerPoints and any other materials. And hopefully that will happen. I think we'll have time to download the videos this afternoon, and so that should happen over the weekend.
So we wanted to leave a good chunk of time for questions and discussion and recommendations. Vicki, if you could go to the next slide, please. And so questions and discussions both in general, thoughts about the work to date and what's needed moving forward. And then there's some specific areas that we're asking for questions or for recommendations and your thoughts about. One is the University of Washington Alcohol and Drug Abuse Institute has a website called stopoverdose.org, and Lucy has been working with Allison Newman, who is sort of runs that webpage about. And I guess Lucy, I'm going to ask you to explain this because I think there's history. I work with Allison; she's great. She recently, our office does a survey with syringe services program participants across the state every 2 years. So the last survey was done in 2019. And there are a number of American and Alaska Native respondents to that survey. And so Allison pulled out the American and Alaska Native responses and put together a report, which she did at a quarterly health commission meeting. I don't remember when that was. It was in person, so it was before January or before March. So Allison does that sort of work. Lucy, do you want to say anything more about?
Sure. Yeah, I would be happy to. Yeah, I think so. I started working kind of more specifically with University of Washington ADI. ADAI was probably 2017. They had a contract with the Healthcare Authority to distribute naloxone. And so that was administered through the University of Washington's ADAI. And part of the work that I worked on with them was specifically how do we, just talking about providing technical assistance and ideas to their team in engaging tribes to, support naloxone distribution in tribal communities. It was broken out into regions, and each region had kind of like a list of, or excuse me, not a list, but communities and areas within their region where they provided training and naloxone kits, actual kits, for free. And so when we were working on that, we also noted, and this is part of some of the work that, again, Marilyn's been working on, just kind of bringing it all together like she usually does for us. One of the things that we had talked about during this time was like the Good Samaritan law and how that's, doesn't always, it's not just automatically aligned with tribal law, and some tribes have adopted those kind of like similar laws, or some tribes had not. And so there was a lot of conversations around that, and also having someone to get the sign off, those kind of things. And so one of the things that we also did was we had a training specifically for tribes on naloxone distribution. Now, this was a while ago, so I think there's been such a huge progress that I've seen in tribes, implementing naloxone distribution in their communities. And so this was kind of a while ago. So we did have a short training. We developed like a couple of materials, like a fact sheet type of material, a one-pager, and a PowerPoint presentation. And then I think we wanted to work more on the, adding more to this website on for tribal partners. There's some resources available. There's specifically resources for law enforcement, specific resources, I think, for community partners. And so we had talked about having some specific resources for tribes. But we also, after that during that time was also when we were working on the Opioid Solutions campaign, and that has its own website. And so it came up where I was on the website and I noticed those materials weren't on there anymore. And so we had a quick conversation to see what's the best approach. Do we want to still have these resources look based on the survey and the comments from tribes through the survey process? It does look like there is still a desire to focus on naloxone distribution, for overdose prevention. And so, yeah, I think that's kind of the history of that project, and I feel like I just gave way too much information. But I've also noted too, in some communities I've heard, it's even the way naloxone is distributed is different now because of fentanyl. There's maybe law enforcement or whoever's carrying naloxone might not need just to carry one. They might need like 4 because sometimes it takes more than one. So just a lot of topic areas around this. So University of Washington ADAI is willing to support and willing to build a tribal page or provide resources. We also have the Opioid Solutions campaign that we could look for too, and that website. So those are just some ideas, and be great to hear from this group how you would like us to move forward on that.
Yeah, Lucy, this is Lisa. One quick or easy solution for now would be for for Allison to put a link to the tribal opioid response page addressing opioid overdose. So that's one idea. And I do know in the survey, the COVID survey, that people who responded said they are increasing access to naloxone in their communities in various ways, co-prescribing or co-dispensing naloxone with other prescriptions, having drive-through naloxone pickups. So that is happening, and ADI will not have the grant for distributing naloxone after this year. It'll be fully under DOH. I want to give time for people to talk, but I think it's really important for people to understand what the second bullet point is. So Vicki, I wonder if you could give a quick summary of that so we can get input from people about the best way to move forward, since that's a really short timeline too. If you're talking, Vicki, we can't hear you. I know you're having some internet, cell phone challenges.
Hello?
Yep, we can hear you now.
Okay. Yep. Sorry, I was actually talking at the data sovereignty work group. So what was the question, Lisa?
Oh, sorry. The second bullet, recommendations for Commerce Cares Act funds.
Oh, yes. Sorry. So, you know, the Commerce Department got CARES Act funds, and earlier during the year, they distributed some to the tribes, one a round of like 100,000 each, and then another one that was based on a very complicated formula. And it was realized that the urban programs got left out, and that also some of the programs that support some of the tribal organizations that support a lot of the work that gets done. And so Craig Bill from the Governor's Office at Indian Affairs and Representative Deborah Lekkenoff worked with the Department of Commerce to get some funding to the urbans and to the tribal organizations. And so from that, we got $200,000. Some of it we already have earmarked for some other work that we're doing, but out of that, we're setting aside some funds to do some response work from that second survey that Lisa talked about, the COVID impacts on opioid response. So we're really looking for recommendations on how to spend those funds. It's about $20,000 that we set aside. And I know tribes do have some CARES Act funds through Commerce that I had a conversation with Ernie Rasmussen yesterday from the Tribal Liaison from the Department of Commerce, and he said he feels like there's some struggles with figuring out how to spend those funds. So we're going to have him next week on the tribal and urban Indian COVID response check-in call to hear. He's got a presentation about how to spend those funds, but we're trying to think about the best ways to provide support and resources to tribes for their opioid response with these funds. Did I explain that well enough?
I think so. I got it.
So if anybody has any thoughts about that, Lisa, you had a list of things that we had talked about that came from the response or from the survey.
Yeah, and I don't have those in front of me, so I probably won't remember all of them. But as Vicki said, to address the needs and concerns that were identified in the second survey, the impact of COVID on communities, struggling with opioid use disorder. So some ways to spend the funds would be to help purchase big tents to continue outdoor safer services with the inclement weather coming, or I guess it's already here, to possibly purchase naloxone for communities that don't have access to it otherwise. So, and to provide training, as identified, staff training, some way to provide staff support, whatever that looks like, whatever communities say will help their staff feel I don't know, less stressed.
But we're really open to thoughts from the tribal communities, from the urban communities. Sorry.
Key, this is Marilyn.
Hi, Marilyn.
I'm just wondering, you know, we put together some, we called them healing or wellness boxes for our community members that included, you know, some aromatherapy, some, you know, we put some cedar bough buds in there, and we also provided some beading kits and just some other things that our community members could utilize to just help them with the isolation and all of that, just to feel a little bit better. And so I'm just thinking, because we had to pull together from various resources to put together, because we didn't want to just provide it for our community members that were involved with treatment programs, but we wanted to provide the boxes for and craft items for our families. So we did it to for all of our families that were living in the community. And so I'm just thinking that you know, that's just one idea that that some of the resources could be utilized for to help those our community members impacted by COVID, but also the stress relief.
That's a great idea. I was also thinking, didn't up there the tribes in your area produce some books about the transformation books? Sorry, I'm not saying it right. Do you know what
Yes, we had the native transformation, and also we did the you know, we updated our gathering of wisdom books.
Mm-hmm. Okay. Yeah.
And so you know, providing the resources for the community members that is helpful for the family. We also provided a couple of lap blankets and various things that could be, you know, utilized for the elders of the family to just feel good about, you know, being warm and that kind of thing.
I love that idea. I'm sitting here with my lap blanket on. Thank you, Marilyn. Any other thoughts? I like the stress kits, Lisa.
Yes, absolutely. Thank you so much.
Mm-hmm.
This is Lucy. I don't know all the requirements of the CARES Act fund. I'm guessing there's some restrictions on there from, you know, I haven't been as in the know even through HCA and what those things can be spent on, but just a couple of requests that I think we've had are related to like technology and phones still. And they're not as much as we used to get, but in minutes, again, I know there's some restrictions, but there's also in the beginning, we got a lot of requests through the Indian Nation agreement to support like the prevention programs with PPE, like masks and things like that. And for whatever reason, I don't know why, SAMHSA did not allow us to purchase those items. So we kind of actually turned down not turned down, but we just sent over that message when we got that request, because it's sometimes prevention programs aren't always connected to the clinic as much, and so access to PPE was a challenge. But some tribes seem to be still working with youth, you know, on a regular basis. So I'm not sure if that's still a need, but just some requests that came my way.
Yeah, I do remember hearing about that. And also was looking for PPE as well for some elders. I'm trying to look at the grant right now. They were medical expenses, public health, testing, public health expenses. Yeah, and you know, the CARES Act funds through the Commerce Department, I know that they've been able to be a little more lenient or creative and working on a case-by-case basis with the tribes on the funds. So I know that we can work with them on things. So just, I think when we brainstorm, we should think of anything possible. And then if these guys can't fund it, I just applied for some funds through our CORA and Group Health Foundation. So I think we shouldn't put anything out there just because we don't think it'd be funded. We should put it all out there and figure out how to fund it. That's how I like to think. And also the funds that, I see Francesca has a question or a comment, the funds that the urban programs got, I think went towards some of those, or is going towards some of those things that you were talking about, Lucy, with the phones. And they were doing things like paying people's rents so that in the moratorium on evictions ends, that people don't get kicked out of their house or apartment. So those are some really needed funding opportunities there. Francesca, did you have a comment?
No, I just put it in the chat, but just in agreement with everything that's been said. The CARES Act dollars have been pretty flexible. We've just kind of been pitching ideas, and so far nothing's been turned down.
Right.
So that's good. Good news for us.
Good, thanks. Good to hear that. So we're right at noon. I just want to see if there's any other comments or thoughts. And I guess our next steps really are to continue to get ideas. Marilyn, I love your stress box or de-stress box idea. Maybe we can work and think of some of the different individual traditional medication or plant medicine that tribes and urban Indians might be interested in. Also, that might be a way for them to spend some of their CARES Act funds, because I know that there have been some struggles with some of the federal funding getting spent too. So I want to thank everybody for your great ideas. Are there any other comments before we break for lunch? So thank you all for participating. And again, we will get this recording downloaded and then up on the website with the materials and resources. And if you think of things afterwards, tomorrow, next week, feel free to reach out to Lisa, Lucy, or I and share your thoughts. We're always happy to hear from people.
Thank you, everybody, and take care.
Thank you. Have a good
Thank you.
afternoon.
Hey, everyone.